It's that time of year, cold and flu season. Everyone seems to have the sniffles. What would you like to know about ear, nose, and throat problems? Good evening and welcome to Doctors on Call. I'm your host, Dr. Ruth Westra from the Department of Family Medicine and Community Health at the University of Minnesota Medical School Duluth. Tonight we'll be taking your ENT questions at 218-788-2844 or toll free at 1-877-307-8762. I'm pleased to welcome our panelists this evening, Dr. Todd Freeman, an ENT specialist with Northland Ear, Nose, and Throat Associates in Duluth, Dr. Jacob Prunuske, a family medicine specialist with the Lake Superior Community Health Center in Superior, and faculty member in the Department of Family Medicine and Community Health at the Medical School Duluth, and Dr. Mark Rhodes, an ENT specialist with Essentia Health, Duluth Clinic. Our medical students answering phones tonight are Robbie Gruhl from Hawley, Minnesota, Adam Langer of Kenyon, Minnesota, and Joel Soma from Harmony, Minnesota. And now on to tonight's program on ENT problems. So since we're talking about sniffles, Dr. Freeman will start out. Tell us the difference between bacterial and viral infections when we get a cold.
Well, a lot of the time it's hard to tell the difference. The latest recommendations from our national organization really kind of center around more about timing. And we kind of assume the vast majority of people who present with upper respiratory tract symptoms are going to be viral. And they encourage us not to really initiate antibiotics, particularly like for sinus infections, until people are 7 to 10 days into persisting symptoms.
How about if they develop hoarseness with a cold?
Well, hoarseness is different. It can have a lot of causes. One of the first questions that I would ask is whether or not that person smokes. Because if it's a person who smokes, I'm more worried about more severe things like lung cancer. A lot of people just lose their voice or get a scratchy voice with a cold. That's pretty common and not particularly worrisome, assuming they have those other cold symptoms with it, and expect the voice to come back as the rest of their illness resolves with time.
So what if it doesn't resolve, Dr. Rhodes? What do we do as far as a workup for hoarseness?
Well, to be honest, the best workup for a hoarseness is to look at the voice box, and that's not particularly difficult with the right tools. So in our office, we can take a good look at the vocal cords and really come up with a pretty good diagnosis without too big a workup.
Mm-hmm. So if they have like polyps, Dr. Freeman, what would we do about that?
Well, polyps are pretty common and almost always benign, and we tend to be very conservative. We try to avoid surgical intervention with polyps, take advantage of our speech pathology colleagues, but really the cornerstones of management of polyps and kind of minor voice issues is voice rest, fluids, caffeine avoidance, and acid suppression if people have reflux.
Mm-hmm. Helpful. All right, how about the big topic of earwax, Dr. Prunuske? What do we do about earwax? We'll start that before we get some more questions here.
So, I mean, as probably like my colleagues here, see a lot of patients who are concerned about earwax. I mean, I think the biggest message I have is for most of the people, most of the time, earwax is not a problem at all. It's actually normal. We all have and make earwax. It actually serves a useful function to move junk out of our ears. So if we get something in our ear that doesn't belong, or it's dusty, or a bug crawls in our ear or whatever, the wax actually helps move things out. And then as we shower or bathe, it washes away. There's nothing wrong with earwax at all. If it's right on the surface, you can see it, just move it away or wash it off with water. When people come to me, one of the most important questions I have is, do you have problems hearing? Because if they don't have problems hearing, I'm not usually concerned about earwax at all, and I'd rather just let things be. If they have problems hearing, there's a couple ways to remove it, either flushing with water, or if you can look and use a little plastic device called a curette to just manually remove the wax. But both of those have some risk. I mean, you can do damage to the canal of the ear, or you could do damage to the eardrum. So if the person just has wax and no other concerns, my inclination is just to provide some reassurance or listen to their concerns, and hopefully try to address the concerns without doing anything more.
Any other additions to that?
I'd agree. Wax is, quote, normal. It's natural. It's always there. and I like to point out it's created right at the opening, and then is coming out on its own. So when you reach up and feel, I always have wax. That's right, it's there, and that's where it's supposed to be, as long as you leave it there and don't push it in further. So that's why we always talk about not using Q-tips. Q-tips are only successful at pushing wax further in where it's not supposed to be. So avoid the Q-tips. There are over-the-counter preparations for wax, and they work. You know, they're not harmful at all, and they can be successful if you do feel you have a significant problem with wax.
I have a lot of patients too who actually cause external ear infection with the Q-tips.
Right.
Like they use the Q-tip, and the skin on the inside of the ear canal is actually pretty sensitive, and people can cause almost like a carpet burn or a rug burn on that, and they actually come in with complications from using the Q-tips themselves. They're worried about wax and actually made things worse by using them rather than better too.
And with chronic use, that often causes itching. So your ear itches, you use the Q-tip more to itch it, which causes more itching, and you get into a cycle that's hard to break.
What do you tell your patients about sticking their head under the shower and trying to flush it that way?
You know, I don't think there's any real harm in that, as long as they don't have a history of ear infections, holes in the eardrum, haven't had surgery on their ears in the past. You know, if you have an ear that is not prone to infections, getting water in them shouldn't be a problem at all.
Well, we'll switch to runny nose,
Okay.
Dr. Freeman. So I have a caller from Saginaw asking about have a runny nose, doesn't seem to get better with steroids or antihistamines. So one of those hard to treat.
I think we have a pretty large number of patients out there who have this kind of persistent runny nose. It's clear secretions. They don't have classic allergy triggers, and it's kind of a wastebasket term that ENT doctors put them in, and it's called vasomotor rhinitis, and it's basically the controls, the neural controls of your nose that tell you when to secrete and when to not are gone. And it's like someone has turned on the faucet and left the room. And it just runs and runs and runs. And it's really frustrating for patients. We don't have really good treatments for that condition. We really don't. But we have three. One is the steroid spray, which this patient has tried, and that can be effective for a fair amount of people. There are topical antihistamine sprays that can be helpful. Even though these aren't allergies, the antihistamines, just as a natural side effect, tend to create drying of membranes, and we can take advantage of that side effect with these sprays, and they can be pretty effective. And then finally there's a medicine that was adapted from asthma care years ago, Atrovent, and there's a nasal spray of this Atrovent medication that can help some people with this vasomotor rhinitis, but it's a frustration for people, and we don't have good treatments. We have these things to try, but we don't have a permanent fix for the condition.
I mean, the other thing to look at is something triggering it, meaning the function of the nose is to kind of clean up the air we're breathing before it gets to our lungs. So I point out, first of all, if you're a smoker, the nose is trying to clean up all that smoke before it gets to your lungs, and so you are really never going to clear up your nose as long as you're smoking, because it's simply doing its job. This time of the year, a lot of people are starting to start burning wood for heat. It puts a lot of particulate matter in the air. Those all can be causes of this chronically stuffy nose. And then certain medications can also have a side effect of a stuffy nose. So those are, the other thoughts too at times.
Yeah. It can be very annoying. People keep Kleenexes stuffed under their sleeves and that type of thing. Dr. Prunuske, a caller from Duluth, having a sore throat for about 2 weeks, and it seems to get worse at nighttime. Is that a reason that they should be seen?
We may be able to help. When I have someone who has a sore throat that's worse at night or worse first thing in the morning, the two things I think about, esophageal reflux or heartburn can certainly cause a worsening sore throat. You lie down at night and acid from the stomach can irritate the back of the throat. And the other thing is people who have runny nose for any cause, whether it's allergy or this vasomotor rhinitis, or even just an illness. If you have a lot of nasal secretions during the day, you can kind of control it. You blow your nose, you swallow it, whatever. But at night, when you're sleeping, that mucus can again fall back and kind of coat the airway and be irritating as well. And both of those things, heartburn and runny nose, can be treated. So I mean, I think if it's bothersome to the person, I'd recommend they get seen, and probably their physician can help.
Very good. Dr. Rhodes, a caller from Trigo. Is there any relief for ringing in the ears?
So
it's a really hard one.
Yes. So ringing in the ears is referred to as tinnitus. Very, very common and very hard to manage. What I like to point out is, no, we don't necessarily have a cure, but there's a lot of things we don't have cures for, but we manage it. A lot of diseases we manage. So even though we say we don't cure ringing, we can manage ringing, and there's a lot of different strategies for that. This includes, for most individuals, the ringing is worse when it's quiet in their environment, primarily when they're trying to go to sleep at night. So we just suggest, create some noise in your environment. Maybe turn a fan on, humidifier this time of the year. That can help. So that's a pretty simple thing, but we are doing something about it. Anybody who does develop ringing should have probably a good hearing test. Try to find what's causing it. By and large, most of the time it's caused from a nerve hearing loss. And sometimes hearing aids can be helpful for that, and as a kind of a side benefit, really help their ringing too. So again, although we say we don't necessarily have a cure for it, we definitely can manage it and help the patient.
So Dr. Freeman, kind of build on that with hearing loss, because I have a couple questions about hearing loss and how they should get it evaluated.
I think is pretty basic, but everybody should consider having it done, and that is a careful exam of their ear to make sure there's no obstructions in the canal, the eardrum's intact, there's no obvious fluid or anything like that, and then an audiogram. And with an audiogram, we test not only how people, typically we test not only where they hear tones, but how loud words need to be for them to hear, and how well they understand speech. And there's a small percentage of hearing loss that we can repair, probably less than 10%, and the majority will be various forms of sensory neural or nerve type hearing loss, which, if it's bad enough, can be helped with hearing aids. And so yeah, I think a basic exam and an audiogram are important, and I think hopefully a lot of people we can help. Can't never make them normal, but we can help.
Yeah, no, I want to follow that up with a patient I saw just earlier this week, had earbuds and turned the music too loud and truly lost his hearing for a matter of a couple hours. The next day he went to sleep, came back with some very faint hearing and sort of making slow progress over time. But just a reminder to everyone watching that when you turn up your phone and it gives you the warning not to go past the line, you really shouldn't go past the line. And that one of the causes of hearing loss, especially in young people, is trauma from loud noises.
Right, and this particular loud noise is this temporary threshold shift is kind of an acoustic trauma type hearing loss, and usually you will recover. You hear it you'll see it with people like forget their ear protection at a gun range or something, and unfortunately most of those recover, but multiple temporary threshold shifts like that will bring your hearing down substantially.
Right, the hair cells in the ear are actually very sensitive, and that loud noise can damage or break them, and that's an easy thing to prevent for most people. Appropriate ear protection if you're firing a gun, and don't turn your music too loud and so forth.
Absolutely.
Prevention so much better than unfortunately, once it's gone, it's gone. We really can't bring it back. So prevention is so much better. And one other thing I just want to mention is there is a kind of a disease that's pretty uncommon, but every once in a while somebody will suddenly lose their hearing in one ear. Wake up in the morning, all of a sudden I put the phone up to my ear and I can't hear anything. That's one of those things for us, we want to see that individual pretty quick, like in a day or two. So hopefully we can help, but if you come in 2 months later, usually we can't help. So.
Like, what about using protection, like for mowing the lawn and things like that, running the snowblower?
Power tools, any of those things, especially firearms. But yeah, power tools, lawnmowers, snow blowers, it's pretty important. and if you have your kids starting to do some of those chores, get them. And really, earmuffs are better than plugs, or use both. But yeah, get it so it's part of their routine when they're doing that sort of thing. Because an ounce of prevention's worth a pound of cure.
Yeah, absolutely. Dr. Rhodes, while we're still on that kind of discussion, how about Menieres? Can
Okay.
you describe Menieres disease? A
Sure.
caller from Superior is asking about that.
So Menieres disease refers to a disease of what's called the inner ear. That's the nerve part of your ear, and that has two parts to it. One part is hearing and one part is balance. Menieres disease refers to an individual whose inner ear is malfunctioning, and so normally they have symptoms of hearing loss, and a bit unique in that it's a hearing loss that will fluctuate. Some days are good, some days are bad. Usually it's more on a week to a month basis. They often experience ringing. They experience episodes of dizziness. So all of a sudden one morning you wake up, your room is spinning, and also fullness or pressure in the ear. Cause of Menieres disease, unfortunately, is really unknown. We definitely do have treatment options for it. Again, maybe not curative, but definitely help control symptoms. And the vast majority of individuals with Menieres disease, combination of dietary management and medical therapy will really handle their symptoms quite well.
Menieres disease is a really rare disease. It's not common, but it's the name's out there, and a lot of people have been labeled with it. And it has very strict criteria to define it. It's usually a one-sided problem, and the vast majority of people with dizziness or vertigo do not have Menieres disease. But the ones that do, we do have some things we can do to help them with, certainly.
So that, kind of to tie into that, the topic of dizziness,
Yes,
which we
yes.
hear quite a bit. And we have what we call the Balance Center, which is a clinic where individuals can come, and we tend to, we run them through lots of tests. It's very extensive testing, and I was just reviewing some of our data a day or two ago of all the patients that come in. And to be honest, less than 30% of them have a problem with their ear. Their balance is from just a myriad of different causes. So unfortunately, dizziness is extremely common, but what gets labeled as dizziness comes with it many, many different factors that are causations. And again, majority of the time, not the ear.
Yes, yes. Like over 200 plus
Right.
diagnoses for dizziness. So Dr. Prunuske, interesting question about neti pots. Can you talk about neti pots and
Sure.
how they work, and
Sure, yeah,
if
of
they
course.
are helpful?
So neti pots, they're available over the counter. Many people use them. It's a container of water, or a container, you fill it with water. And the idea is that you will use it as a flush. You pour it in one nostril and try to flush things out the system. With a clean pot and saline, they can actually be pretty effective for some sinus symptoms. You want to be careful that the container or the pot gets clean so you don't harbor infection in there and make things worse. Obviously you don't want to use water that's too hot and burn yourself and so forth. But in general, neti pots are just fine, and a lot of people find them very helpful in controlling sinus symptoms.
So just to get back about that protection for ears, there's a caller from Duluth asking, with toddlers and infants, is there any recommendations you have for protection for their ears? Hard to keep things on probably most of the time.
Try to
but
keep the child away from the loud sounds if that's
Yes, yeah.
practical or makes sense. I've got little kids, and sometimes it's not that easy, but if you know you're going to be working with the power tools, you probably shouldn't have your baby in your back while you're mowing the lawn or in the sling, but everyone's life is different. I think, again, as you were saying earlier, prevention's probably the best bet. Is find someone else to watch your child while you're doing whatever it is that's going to cause loud noises, if it's at all possible.
Absolutely. Dr. Freeman, can cysts in the throat recur? It's a caller from Duluth.
Cysts in the throat. So
I don't know quite where they're.
I guess some of the probably one of the more common cysts we see would be a a thyroglossal duct cyst that occurs in the upper third of the neck. That cyst, when we do surgery on that, we don't just take the cyst out. You have to take an entire tract out that can form. And if that tract isn't removed, they can recur, certainly. But if you do that operation, boy, they usually don't. Cysts in you can get mucus retention cysts in your tonsils and the base of your tongue, and those are really benign things, and they can certainly come and go. Those are, I guess, the two main most common cysts we deal with.
I've never heard of anyone refer to cryptic tonsils as cysts, but someone might describe them as cystic. I mean, there's a condition where people get little divots, for lack of a better word, in the tonsils, and they can collect food and stuff and cause bad breath, and you know, those can last a long time, but it's sort of a different mechanism or a different underlying cause than I think what we would think more classically as a cyst.
You can get little mucoceles, especially on the inner aspect of your lip from minor trauma, and those certainly can be stubborn and can recur. But most of these things are benign conditions.
I think for this particular question, that this is a pretty specialized topic.
Yes,
that if this individual has it,
We
he
could go
should just
on.
talk to their provider, because we're not really sure what kind of cysts they're talking about.
Well, Dr. Rhodes, a caller from Mountain Iron asking about stapes implants. How long do they last?
Oh, okay. So what that's referring to is one of the bones in your ear. In fact, your smallest of the three little bones in your ear is called the stapes. And there's a disease called otosclerosis, in which that bone becomes fixed into place. And so we can replace it with a prosthesis. For many individuals, that prosthesis will last their entire life. It doesn't degrade in any way. It sometimes can fall out of place, but it can last, again, the lifetime.
Dr. Prunuske, sometimes when you get a cold, you lose your sense of smell. I have several questions asking about sense of smell.
Sure.
You lose it with an infection, will it come back?
Sure. In most cases, yeah. So our sense of smell is lots of different nerve endings in the nose, and if the nose gets real inflamed, so actually this is common in people who smoke, their sense of smell is much diminished. In people who get a sinus infection, who have allergies or a cold, anything that causes a lot of inflammation in the nose can reduce our sense of smell. And typically when whatever it is that's offending goes away, the sense of smell comes back. In most cases, complete loss of sense of smell is really, really rare, and usually that's a result of trauma to the face or something where you're actually going to sever those nerves. That's not a subtle thing, and people know when that sort of thing happens. So I suspect when people say, "Oh, my sense of smell is lost," it's really just diminished, and as things heal up, the sense of smell should come back.
How about Dr. Freeman, talk a little bit about ways to prevent nosebleeds. Sometimes it's really dry, so several callers asking about nosebleeds too, so we'll kind of wrap those together.
The two main causes of nosebleeds are dryness and trauma. And in this climate we live in here in the Northland, our air is dry for 6 months of the year. It is extremely dry. And trauma, it doesn't mean necessarily getting punched in the nose. It's more has to do with blowing, rubbing, scratching, and you manipulate those dry membranes and you can get a bleed started. So the biggest things people can do who are having problems with nosebleeds is nose blowing, be a sniffer. And then the second thing is add moisture, and probably the two easiest ways to do that, you can buy little bottles of saline spray over the counter at a pharmacy, and you can never use them too much. And then there are glycerin gels you can use in your nose, which are much favorable to Vaseline or petroleum products. You want to use a glycerin product in your nose. Those are the two major things you can do to try to minimize nosebleeds.
And then try to increase the humidity in your environment. So I think humidifier this time of the year, put your humidifier on in your bedroom and just try to increase it a little bit. It can really help.
Good, excellent. Just a real final one, Dr. Prunuske, about tickling feeling when you lay down in your ear. We'll end with that one.
I have absolutely no idea. Happy to ask one of
I'm
these
lost
two
on that
guys.
one.
Yeah, I'm not, I'll be honest, I can't come up with that one right off the top. We'd have to ask a few more questions about that.
But it was a good one to stop
Okay.
with. So I want to thank our panelists, Dr. Todd Freeman, Dr. Jake Prunuske, and Dr. Mark Rhodes, and our medical students, Robbie Gruhl, Adam Langer, and Joel Soma. Please join Dr. Ray Christensen for a program next week on stroke and other neurological problems, when his panelists will be Dr. Dimitrios Wanakidis, Dr. Samuel Laney, and Dr. Jacob Prunuske. Thank you for watching. Good night.